The third common cause of back problems is really disc problems. So the discs are the cushions that sit in between the vertebrae and your spine. Their job is to create space in between the vertebrae so that the nerve has space to come out of. Now there's really three things that can happen when we're talking about disc problems. The first thing is that a disc can become degenerative. So the disc gets smaller, it just shrinks in size as we age. Now that is expected, that is okay, but it's not okay for you to have symptoms because that's happened. As that disc is shrinking in size, the space or the opening for the nerve is getting less. And so you can start to have problems with back pain and leg pain associated with that as well. The second cause for disc problems is what would be called a bulge in the disc. So the disc is like a jelly donut. There's fluid in the center of that disc. Well, when the disc starts to have too much pressure on it, most commonly because of repetitive injuries to the spine or muscular injuries that are causing pressure down through the spine, you'll end up with this disc that starts to bulge out to the side. Well, that bulge can start to put some pressure onto the nerve and give you those symptoms as well. And the third thing that can progress to is a bulging disc can actually turn into a ruptured disc. So because the pressure continues on that disc, a hole would actually form, kind of like a cut in your skin, and now it would leak fluid out, which would constantly be putting pressure on the nerve. Back problems related to discs usually have back pain, but they will also have some semblance of symptoms down into a part of your leg as well, because again, the nerve is getting pinched on, and that nerve runs a specific line down a part of your leg. With a disc issue, unlike muscular and sacroiliac issues that are worse with movement, a disc issue is actually worse when you're sitting still, because that pressure builds up where the pressure isn't being relieved. Disc problems will actually cause you more symptoms with either immobility or with way too long of a prolonged period of mobility. The number one way to handle back problems is through physical therapy. So here at Loudon Sports Therapy Center, our expert physical therapists are all expertly trained in handling low back problems. Really, the way that starts is with a full assessment. Somebody's got to take a look at what your problem is and how you move and what's causing the symptoms. Because just like that check engine light, there could be 1,000 reasons for what's going on. It could have originally started out as a muscle problem, but now it's beginning to exhibit some disc symptoms. And each of those things need to be addressed through some treatment. So basically, through a full comprehensive evaluation, we can figure out what are all of the things that are causing that back problem. Get you started on a regimen of things that's going to address them so that number one, you start feeling better right away, but more importantly, number two, we address this problem before it has a chance to progress into something else. Obviously, the easiest way to do that is when it's a muscular problem. A lot of times people don't handle that problem right up front. They'll wait until it starts to cause some symptoms down the leg. Now that check engine light's been on and it's stayed on for a couple of years or a couple of months at that point. But regardless, we can still handle all of those issues manually through some mobilization and manipulation techniques and hands-on techniques. Get the alignment of the spine back to where it needs to be. Get the control and the support of the spine such that the curves are where they need to be. Get the muscles to be longer and looser. So yes, that's some exercise, but it's also some manual techniques and some other techniques that go into that as well, to getting those muscles to relieve the pressure on the spine, open up the spaces, get the pressure off of the nerve. Yes, get you feeling better, but by getting those curves back to where they need to be, the alignment back to where it needs to be, now it makes sure that this problem is not something that's more likely to occur in the future or that's going to come back and cause you much greater problems in the future.